Jai Hind and good day friends. This is Dr. Shivam and we are going to have a clinical discussion on the topic of mixed parotid gland tumors. You have been presented with a patient having slow growing painless swelling in the parotid region of about 5 cm in diameter, firm and lobulated surface. The swelling is not adherent to the masseter muscle, overlying skin is free and facial nerve is normal. Ear lobule is raised, no regional lymph node has been found to be enlarged. Now tell me, what are the points in favor of your parotid swelling? Yes, sir. I am saying it as parotid swelling because the swelling is below, in front, and behind the ear lobule, obliterating the normal furrow behind the ramus of mandible. The lobule of the ear is also seems to be lifted up. Okay, tell me the points in favor of mixed parotid tumor. Sir, the point in favor of mixed parotid tumor are, first of all, it is lying in the parotid region, the swelling is painless, slow growing and lobulated, it is mobile and the skin is not fixed, facial nerve is not involved, regional lymph nodes are not involved. Okay, you have told me that the swelling is in parotid region. Can you tell me what you mean by this parotid region? Sir, it is the region which is more or less bounded above by zygoma, below by line joining the angle of mouth to the mastoid process, anteriorly by anterior border of masseter muscle and posteriorly by mastoid process. Okay, what is the significance of this parotid region? Sir, any lump in this region is considered a swelling of parotid gland origin until and unless proven otherwise. Okay, now tell me which is the most common tumor you found in a parotid gland? Sir, most of the tumors of parotid gland are benign tumors and it constitutes about 80%. 20% are malignant and among benign or overall the pleomorphic adenoma or the mixed tumor is the most common benign tumor while mucoepidermoid tumor is the most common malignant tumor. Okay, now tell me why you are calling a pleomorphic adenoma as mixed tumor? Sir, I am calling it so because the pleomorphic adenoma contains different types of cell in its tumor. Actually, they are derived from columnar or squamous epithelial cell by mucoid degeneration. The epithelial cells show various forms and thus it is called pleomorphic adenoma. Okay, so is it truly benign? Sir, it is benign but potentially malignant. It is seen that the capsule is deficient, recurrence is common after excision, and it may undergo malignant change in about 2.5% of cases. Okay, so you are talking about malignant changes. So, what are the points that will suggest its malignant conversion? Sir, if I find in my patient sudden rapid growth in a long-standing parotid swelling or tumor, sudden occurrence or starting of pain in the swelling becoming fixed to skin, muscle or bone, presence of facial nerve palsy, enlargement of cervical lymph node, restricted jaw movements, infiltration of surrounding tissue, and hard and irregular mass. Okay, now can you tell me how a salivary gland tumor is classified? Yes, sure, sir. According to the International Classification of Salivary Gland Tumor, it can be divided into epithelial tumor and non-epithelial tumor. Among epithelial tumor, it can be further divided into adenoma, mucoepidermoid tumor, acinic cell tumor, and some other carcinomas. Among adenoma, it is further divided into monomorphic and pleomorphic. Among carcinomas, it is further divided into carcinoma in pleomorphic adenoma, adenoid cystic carcinoma, adenocarcinoma, epidermoid, and anaplastic. And the second category of non-epithelial tumor which are rare but can be found are benign hemangioma, lipoma, neurofibroma, and some malignant like rhabdomyosarcoma and liposarcoma. Okay, so what are the possible probable causes of swelling in the parotid region? So it can again be further divided into neoplastic, non-neoplastic, and some miscellaneous causes. 75% of the causes are neoplastic. The rest, non-neoplastic, contains acute and chronic parotitis, parotid calculi, acute unilateral or bilateral as in mumps, malformations like lymphangioma, hemangioma, cyst, chronic infections like tuberculosis and sarcoidosis. Among miscellaneous causes, some drugs like antithyroid, iodides, antidepressant, cirrhosis enlargement due to metabolic or hormonal, and diabetes and acromegaly, Mikulicz and Sjogren's disease and syndromes. Okay, now tell me how you will confirm your diagnosis in a mixed parotid tumor. Sir, I will first judge my patient on the basis of clinical ground, will advise him a FNA, sonography, and MRI, contrast enhanced, and CT scan as and when required. What are the new investigations you are seeing or using for salivary diseases? Sir, a very new investigation called diagnostic cyaloendoscopy and therapeutic cyaloendoscopy procedure are being used for removal of debris, dilatation of a stricture, and removal of stones. Okay, so what is the differential diagnosis in this case? Sir, it can be a lipoma, neurofibroma, sebaceous cyst, bony tumor, preauricular lymph node, or Warthin's tumor. Okay, you told many differential diagnoses. Can you tell me one line in favor of each one? Yes, sir. Lipoma are the soft lobulated margin slips under the examining finger. Neurofibroma is usually fusiform, firm to rubbery in consistency, often multiple, and it may be tender. Sebaceous cyst is cystic, adherent to skin, and punctum is present. Bony tumor are hard and attached to bone. Preauricular lymph nodes are firm, smooth swelling just in front of tragus, usually mobile and outside of the parotid capsule. Warthin's tumor is usually in the tail of parotid gland, more common in male. The tumor is soft, smooth surface and often fluctuates. Okay, so you have been talking about cyaloendoscopy. So can you tell me what is cyalography? Yes, sir. It is a contrast radiological study to visualize the ductal system of salivary gland. A water solution of lipoidal is injected into the orifice of Stenson duct which open in the buccal surface of the cheek opposite the second molar tooth. It will demonstrate us with any obstruction of the duct, dilatation of the duct and acini, and locate the site of lesion in parotid fistula. Okay. Now tell me, what are the complications of pleomorphic salivary adenoma? Sir, as already told, it can undergo malignant transformation and there are chances of recurrences, often multicentric. Okay, so what are the peculiarities you will see in a mixed tumor in gross pathology? In gross pathology, it seems to arise from acini of the parotid, unicentric or maybe multicentric. Capsule is thin and composed of compression of surrounding salivary tissue. Capsule is incomplete, nodular or small tissues of tumor projects out through the defects in normal salivary tissue, or it is variable in size from plum to fetal head. What is the treatment of mixed tumors like this? Mostly superficial parotidectomy with facial nerve preservation is being done, but if deep lobe is involved, we prefer total parotidectomy. What precaution will you take during operation of superficial parotidectomy? Sure, sir. Seeing the present condition, proper consent and information of the patient and asking his relative regarding possibilities of complication and conditions like chances of facial paresis and paralysis, chances of Fraze syndrome and chances of recurrences should always be taken. Okay, you talked about recurrences in cases of mixed parotid tumor operation. So what are the causes of these recurrences? So the causes may be due to incomplete pseudocapsule or inadequate and incomplete removal of the tumor and multicentric origin of the tumor. It can also be due to implantation occurring during manipulation by spillage or dominant biological behavior. Okay, that's great. You have responded very good. So this was the end of the discussion. Thank you for your patient listening. This is Dr. Shivam signing off.